Now if you'll turn to ECG exercise number 16 on page 92, and we'll begin with a heart rate here. So again, remember, we always try to interpret the underlying rhythm, and then we describe the FLBs, right, the funny looking beats. So the heart rate here is approximately 120, and again, this is an irregular rhythm, so you could interpret this heart rate a little bit differently. The gold standard always being check the pulse. Does the pulse match the monitor, those kinds of things. But if we look at this QRS that falls in a dark line, the heart rate is 300, 150, 100, 10, 20, approximately 120 based on that. P waves are present and upright in the underlying rhythm. The PR interval is 0.16 second in the underlying rhythm. That's normal. QRS is narrow in the underlying rhythm. But we have these complexes here which are wide and bizarre, and there are no P waves preceding these wide and bizarre complexes. That's a T wave, if you're wondering what that is. And again, here we have a wide and bizarre complex with a T wave before it, no P wave. A wide and bizarre, no P wave before it. And the ratio in the underlying rhythm is 1:1, and the rhythm is irregular. Now, the underlying rhythm consistently has a P wave, a narrow QRS, with a normal PR interval, a narrow QRS, and a rate of 120. So that tells us that the underlying rhythm is a sinus tachycardia. What are these things? Well, they're wide and bizarre without P waves preceding them, and they're all different shapes or different morphologies, so they're multiform. And so wide QRS without discernible P waves that happens earlier than the next expected beat, because we would expect the next beat to be about here. So wide, no P waves, early or premature. These are premature ventricular complexes. So the interpretation is this a sinus tachycardia of 120 per minute with frequent multiform premature ventricular complexes, right? And you know, if you want to call them multifocal, go ahead and call them multifocal. As I mentioned in one of the previous presentations, electrophysiologists like to go in and they map out the heart, and sometimes they'll find the focus that's causing that premature ventricular complex, and they'll say, well, you know, these two PVCs may be slightly different in shape, but they're coming from the same focus, because on one occasion the wave of depolarization goes off in one direction. On the second occasion, the impulse coming from the same focus fires initially in a different direction, giving you two different shaped premature ventricular complexes, hence the term multiform, which is a little less committal than saying multifocal. So if you want to call it multifocal, knock yourself out. But multiform is a little more vague, a little less committal, and you're just describing the morphology, right? This one is a different shape from this one, and guaranteed this one is coming from a different focus from this one, because you notice the polarity of this one is opposite direction from this one. This is positive, this is negative. But this one and this one could actually be coming from the same focus, so we call them multiform. And again, this one, different focus. So that's the interpretation: sinus tachycardia, heart rate of 120 with frequent multiform PVCs.